Hi, Dr. Marik. Good to see you.
Yes, you too.
So what happened here? We had the IMA event. This is the first time. It used to be FLCC, and you've been involved in the FLCCC from the start, right?
Yeah. So me and Pierre Corey kind of started this in March of 2020.
I so much appreciated your strong stand in the medical, trying to help people. Can you tell me a little more about the hospital, anything about what happened there and why you started the FLCCC?
Yeah, so I mean, if you remember when COVID came out, the NIH said that there's no treatment.
Right.
You stay home, you go blue, and then you go to hospital. And obviously, as a physician, that's the most absurd thing, because there's no disease you're not going to try and treat.
Yeah.
So that's why we put together first a protocol for the hospital treatment of patients.
Right.
And then we realized we really want to keep patients out of the hospital.
Okay.
So we developed a protocol for people to take it home so they could be treated early.
Right.
And not go to hospital.
Right.
And that's really how it started.
Yeah, but you didn't have a lot of choice. All of a sudden, you found yourself not being able to go back to the hospital, something like that?
So basically, I was trying to do what I was doing for my patients in the hospital.
Trying to get your patients out of difficulty.
But it was going against the NIH protocol, the NIH narrative, and I refused to use remdesivir, and so I found myself without a job.
Oh, well, the best thing that happened to that was the FLCC, and now the new version IMA, which I think is more collective, right?
Yes.
Can you describe the IMA for me?
Yes, so I mean, out of it came the FLCCC, so at least you're right, we have a mission. And in a way, before I was treating one patient at a time.
Right.
With the FLCCC, we were touching hundreds, if not thousands of patients. And traveling around the country and the world, I realized how many people's lives we did affect.
Well, I remember in Canada, I don't know how many people I recommended to the FLCCC website. It was like a lot of people. So you guys were standing strong.
Yeah, so obviously now the healthcare environment has changed with the change in Washington. So I think
RFK coming in, that's going to be fantastic. I really hope, I'm from Canada, but I really hope it trickles upward to Canada and, some of those good things that are happening down here.
Yeah, so obviously there's a lot of uncertainty, where this is going to go.
So I got a chance to meet you, a year ago, something like that.
Yeah.
I came to visit you.
Yes.
And I felt that you had some very great interest in PBM, photobiomodulation.
Yes.
As everybody calls it, RedLight Therapy, cold level laser therapy, all these terms, but now finally PBM is the new term that everybody needs to know. It's the new scientific searchable term, photobiomodulation. But tell me about what you know about photobiomodulation, what you've been able to see.
Yeah, so I kind of heard about it earlier along in the course, just because we were looking, we were up against a strange enemy. I was looking for novel therapeutic interventions.
How dare you?
And so photobiomodulation made a lot of sense because, I think a lot of diseases has to do with mitochondrial dysfunction. And much of the brain is a really complex organ.
Yes.
And you have, many of the problems have to do with neuroinflammation. So the problem with COVID,
Alzheimer's,
with COVID and
long
brain fog and post-vaccine injury is neuroinflammation. It seems autism is brain inflammation, and then also you have, brain atrophy and loss of brain fibers and loss of neuronal tissue. So what you want to do is maintain brain function.
Right.
And obviously,
at whatever state it is, but try and either maintain it or improve it. If you
so
can.
It doesn't matter what state you want to. It's never too late to treat.
Right.
Obviously, you want to prevent. So I feel my memory is going. So I'm at a stage that I want to do things to try and preserve my brain function.
You got to try my helmet out.
So I actually do, believe it or not, I do photobiomodulation every day.
Right. And you got one of my devices, thank you.
Yeah, I sit in my little chair and I do my photobiomodulation, and hopefully it's doing some good. I don't know.
Right.
The data shows that it is.
Yeah. I have one.
Makes sense. It's not. There are a lot of things out there that are a bit shaky.
Oh, there's a lot of fairy dust. How's that?
And so you want to be careful of snake oil medicine.
Yeah.
And so I think the photobiomodulation is supported by good science.
Thank you.
And
Thank you.
the first thing obviously is first to no harm. So I think it's very safe.
Non-invasive and many
Yes.
other things. It's beautiful.
So I think people who have who have neurocognitive issues got nothing to lose.
Yeah.
And therefore it's also very good for injury, because it improves blood flow.
Yes.
Which is important.
And lymphatic drainage in the other parts of the body. And I'm learning now, Dr. Ryan Cole was talking to me about the lymphatic system.
Yeah.
And anytime you can improve blood flow, improve your lymphatic system, things are helping. But it's so exciting with this event here. I've been able to connect now with some of the people I've met before, like yourself, but also we're looking at starting a study for inflammation, brain fog. Dr. Joe is going to, from the panel there, we're going to get a study for autism, and we're going to get another study for myocarditis.
Yeah. So I think those are good things to do. There'll always be skeptics who are going to criticize your study, whatever the study is. So they're difficult to do, but I think just the idea of doing a study, collecting data, looking at data is always a good thing. You can never lose from doing such a thing.
I want to thank you so much for taking a few minutes with me and telling the listening audience what's great and what's coming with the IMA.